So monitoring is probably one of the most vital steps in ensuring a good anesthetic outcome. And AHA, which is the Animal Hospital Association, American Animal Hospital Association, does provide some monitoring guidelines. From what we see, I would say blood pressure monitoring is the number one monitoring equipment and piece of monitoring equipment, and that can be difficult in some of the smaller animals to get working, and so people tend to go, oh, it's just not working, and ignore it. And it might be that it's not working because the blood pressure is really low. We see an incidence of about 28 to 32% of our healthy animals having low blood pressure. So it's a pretty high complication rate and very treatable. So that's probably the number one piece of monitoring equipment. An electrocardiogram or ECG would be helpful to ascertain what rhythm abnormalities. Not as common in healthy patients, but if you have one, it's well worth using it. And then on the respiratory side, a pulse oximeter. It can give you both oxygen saturation as well as heart rate, and it's minute to minute, very easy to use. Sometimes doesn't work, but most of the times it's a valuable tool. And then on the other side, a capnograph or respiratory monitor that gives you carbon dioxide, so indicates ventilation. That piece of equipment, while very useful, really needs someone who knows how to interpret it. It can be misinterpreted, and there are equipment effects that people need to be aware of if they're using it. But in the right hands, a very useful tool.